Hello and welcome back to my blog. I'm outside. Wanted to get started earlier when there was more light. October 23rd in Columbus, Ohio. This is Indian summer. It's beautiful in the 70s. I'm going to read from Hell's Kitchen again because this is something I think is really important. There's a lot of misunderstandings about this. What is adult onset type 2 diabetes? Adult onset type 2 diabetes, insulin-resistant diabetes, is a simple mineral deficiency disease. Insufficient dietary intakes or reduced absorption efficiency of chromium, vanadium, and other minerals produces increased blood levels of insulin. Increased blood levels of insulin produces hypoglycemia, hyperinsulinemia, narcolepsy, prediabetes, and adult onset type 2 diabetes, insulin-resistant diabetes. Adult onset type 2 diabetes produces more insulin than non-diabetics. Adult onset type 2 diabetes is not an insulin problem. Rather, it is a simple mineral deficiency problem. The relationship between chromium, vanadium, insulin, and heart disease shows why the most common cause of death in diabetics is cardiovascular disease. This relationship is described by Walter Mertz, MD, who reported that chromium was an essential nutrient in 1955. He was soon appointed to the chairmanship of the USDA Human Nutrition Research Center in Beltsville, Maryland. This is a quote, the most consistent effect of marginal chromium deficiency is elevated insulin response, and the first effect of chromium supplementation is the restoration of a normal response. It appears that if we improve glucose tolerance, restore normal insulin levels, and at the same time lower cholesterol levels, particularly LDL cholesterol, the bad cholesterol, we may reduce the risk of cardiovascular disease. End of quote. And that's not true, the part about the cholesterol. The rest is. Richard J. Doisy, PhD, professor of biochemistry at the State University of New York, Upstate Medical Center, tested the effect of supplemental chromium on normal 20 to 25-year-olds. He found when healthy individuals were given chromium supplements, their pancreas did not have to produce as much insulin to manage their blood sugar levels. This could be interpreted that even in normal subjects, the dietary intake of chromium is marginal. Dr. Doisy concluded, my contention is that probably 1/4 to 1/2 of the people in this nation are deficient in chromium. We have relatively high tissue chromium levels at birth, and it's downhill from there on in. And the result for the health of Americans is that millions have maturity type 2 onset diabetes. And millions suffer from vascular disease, he reported. You tend to increase the rate of your chromium excretion when you're eating excessive carbohydrates, said Dr. Doisy. And if the diet is not providing sufficient chromium to make up for the increased rate of loss, then you are going to be in negative balance. We have known since the 1957 reports by Walter Mertz that the deficiencies of chromium and vanadium are the primary causes of diabetes. However, the concurrent deficiencies of other essential minerals will throw gasoline on the fire of diabetes and produce all of the complications associated with the chronic form of the disease. Chromium is required for circulating glucose tolerance factor to function properly. Chromium is an essential trace element necessary for the normal glucose metabolism. Its function is directly related to the function of insulin. Only the trivalent state of chromium is biologically active, and it works by forming complexes with organic compounds. Insulin-chromium relationships are not restricted to glucose metabolism. Animal studies have shown that chromium stimulates amino acid transport and protein synthesis. Deficiency of chromium is characterized by glucose intolerance, hypoglycemia, insulin resistance, hyperinsulinemia, and diabetes. Poor growth, peripheral neuropathies, negative nitrogen balance, loss of muscle mass, sarcopenia, and a decreased respiratory quotient. The dramatic drop in serum chromium started when the wood ash byproduct of cooking and heating was no longer available for culinary ash, and when the ashes were no longer being placed in our gardens. Signs of chromium deficiency in the human: impaired glucose tolerance, hypoglycemia, hyperinsulinemia, diabetes. Elevated circulating insulin, glycosuria, sugar in the urine, fasting hyperglycemia, elevated blood sugar, impaired growth, decreased longevity, elevated serum cholesterol and triglycerides, increased incidence of aortic plaque, arteriosclerosis, peripheral neuropathy, brain disorders, dementia, decreased fertility, and lowered sperm count. By 1977, K.N. Gijiboy reported that chromium could eliminate the need for medical insulin in human patients. His intravenous use of chromium in human diabetics eliminated peripheral neuropathies and well as eliminated the need for insulin treatments to stabilize blood sugar. On August 31, 2004, Harvard investigators released the results of a 15-year study on toenail chromium levels and their relationship to the rate of diabetes. The Harvard School of Public Health scientists analyzed the toenails of 33,000 men ranging from 40 to 75 years of age. They found that the men with the lower levels of chromium in their toenails had higher rates of heart disease and diabetes. The study was published in September 2004 issue of Diabetes Care, the official journal of the American Diabetes Association. In 1991, the University of British Columbia declared that the trace mineral vanadium could replace insulin for adult-onset type 2 diabetics. Vanadium appears to function like insulin by altering cell membrane function for the ion transport process. Therefore, vanadium has a very beneficial effect for humans with glucose tolerance problems by making cell membrane receptors more sensitive to insulin. Vanadium inhibits cholesterol synthesis in animals and humans. This is followed by a drop in plasma cholesterol and reduced aortic cholesterol deposits. The number of Americans with diabetes in 1980 was 5.8 million. In 2004, the numbers rose to 13.3 million, with an estimated 17 million American diabetics undiagnosed or at the pre-diabetic state. In between 1988 and 1994, 45.7% of Americans over the age of 18 years with diabetes were obese, and between 1999 and 2002, 54.8% of Americans with diabetes were obese. I just wanted to clear the air a little bit about the concept that diabetes is caused by consumption of carbohydrates and sugar or grains, and that just cutting out your grains and your sugar intake can turn around your diabetes. Of course, it can manage the symptoms, but it doesn't correct the root problem. Deficiency of all minerals, and especially chromium and vanadium, is the root problem. So that's all for now, and more tomorrow. Make it a great day. Bye for now.